All right, welcome everyone. Ready for a deep dive into this AD prep? We're going to tackle these study guides and pull out what you really need to know. Plus, maybe some stuff they don't tell you outright, for an extra edge.
Yeah, think of it like we're your guides through this whole information
Oh,
jungle,
yeah.
right? We'll point out the important stuff and maybe some shortcuts you didn't even realize were there.
Perfect. So the AD, as you probably know, it's not just about your grades. It's supposed to show dental schools what you're capable of. And one thing that jumps out from this Tongue 25 guide is how much they talk about fairness.
It is interesting, yeah. They're not just saying, hey, everyone can take the test. They're going deeper. Like they design the ADAT to specifically measure your skills, no matter your background or, well, any disadvantages you might have.
So like a level playing field. They're trying to make it as unbiased as possible.
That's the goal. And it ties into their whole thing about diversity and inclusion in dentistry, which they bring up at LI. Makes sense, right?
Yeah.
You want dentists who reflect the patients they're serving.
Okay, here's something that kind of caught me off guard. And I got to be honest, it's a bit intense. They spend a lot of time on ethics, like starting A&W, not just when you're a dentist with patients.
It goes beyond just not cheating on the ADAT. Yeah, they're talking about being honest on applications, licenses, your whole career. I think it shows how much the ADA values ethics. Like it's the bedrock of the whole profession.
Why do you think that is? Is it because in healthcare, trust is everything?
Oh, absolutely. A dentist's integrity is paramount. Patients need to know they can trust your judgment, your decisions, everything you do. And that starts way before you ever even treat your first patient.
All right, so let's get into the exam itself. We've got those three main sections: biomedical sciences, clinical sciences, and then the data research evidence-based dentistry. What stands out to you about each one?
Well, biomedical sciences, that's a huge GE amount of info. Like everything from the tiniest cells to how the whole body is structured, they're really testing how broad your knowledge is.
So not enough to just memorize a few facts. You need a deep understanding of the science behind dentistry.
You got it. Think about the connections between different systems, how the body works as a whole, not just isolated bits of info. And don't get lost in the tiny details. Focus on the big stuff.
Okay, makes sense. What about clinical sciences? You mentioned before it's a mix of standalone questions and then ones based on patient cases. Should people study for those differently?
Yeah, with those case-based questions, you're not just remembering facts, you're using them to solve a problem. It's almost like a little mystery you got to figure out. You get the patient's history, their symptoms, maybe some lab results, and you got to put it all together. Make a diagnosis or recommend a treatment.
So it's like being a real dentist, except you're doing it all on paper. And I bet those dental charts and patient boxes, those become even more important
Oh,
here.
they're critical. You got to be comfortable reading those charts, understanding what all the symbols mean, recognizing different types of fillings or conditions. They give you some examples in the guide, but find more resources to practice with.
Okay, noted. Now the data research section. I think a lot of people, as soon as they hear research, they freak out a little.
I get it. But remember, this section isn't about being a statistics whiz. It's about thinking critically. Can you look at a study, understand its strengths and weaknesses, and compare it to others?
So being a smart consumer of research, which is huge for any healthcare field, right? Especially with new treatments and technology always coming out.
Exactly. Think about it like this. Two studies, totally opposite conclusions about a new dental implant material. Which one do you trust? Which study was done better? That's the kind of thinking they're testing.
It's almost like you're a judge in a science court case. You got to weigh the evidence and decide, not based on your opinion, but what the data says.
Love that analogy. And that skill, it'll stick with you throughout your whole career. New research always comes out, and you got to evaluate it and make smart decisions for your patients based on that.
All right, so we've covered a good chunk. The ADA's focus on fairness, why ethics are so important, and a peek into each of those three main sections.
But there's still more to explore.
Definitely.
All right, welcome back to our ADET deep dive. Last time we were looking at kind of the big picture, but now let's get into the nitty-gritty, the stuff you need to know to ace this thing.
Okay, so section by section, right? Starting with biomedical sciences, which, I mean, it covers everything: anatomy, cells, genetics. Where do you even begin to study for that?
It's a lot, T, no doubt. But the ADA does give you a pretty detailed outline in the guide. That's your roadmap. The key is it's testing if you've got that solid foundational science knowledge that dentistry builds on.
So it's not about like memorizing every single fact from your biochem textbook or whatever. It's more about understanding the big picture.
Exactly. Like, how do different systems in the body connect? How does it all work together? Don't get bogged down in tiny details. Focus on the big concepts.
Okay, I can see that. Clinical sciences, we were talking before about how it mixes those standalone questions
Yeah.
and then the ones based on patient cases. Should people be studying for those differently?
Oh, yeah. Those case-based questions, it's not just knowing facts, it's applying them to a situation. It's like, uh, a mini mystery you got to solve almost. You've got the patient's history, their symptoms, maybe lab results. You got to put those pieces together, figure out the diagnosis, what treatment to recommend.
It's like being a dentist,
Yeah.
but just on paper, I guess. And those dental charts and patient boxes, those become even more important here, right?
Oh, for sure. You have to be comfortable reading those charts, knowing what the symbols mean, spotting different types of fillings, conditions. The guide has some examples, but seriously, practice with as many as you can find.
Got it. Okay, the one everyone gets scared of. Data research, evidence-based dentistry. Just hearing research, some people shut down.
I totally get it, but this section, it's not about being a statistician. It's about, can you think critically about research? Look at a study, see its good points, its bad points, compare it to other studies. That's what they're looking for.
So like being a smart consumer of research, which is, that's huge EE for any healthcare field,
Yeah.
especially with new treatments and stuff always coming out.
Exactly. Imagine this. 2 studies, totally different conclusions about some new dental implant. Which one do you believe? Which study was done better? That's what they're getting at with this section.
It's like, you're the judge in a court case, but for science.
Mm-hmm.
You got to look at the evidence, make a decision based on that, not just what you feel.
I like that. And honestly, that's a skill that'll last you your whole career because new research is always coming out,
Okay.
right? You got to evaluate it, make good choices for your patients.
All right, let's shift gears a bit. Retesting policies. This is something I know a lot of people stress about.
Yeah, it's good to know the rules. So the ADA lets you retake the ADA, but there are limits. 45 days at least between attempts and only 2 tries per testing window.
So no, just taking it every weekend till you get the score you want.
Nope. They want to make sure it's fair. Plus, they want you to actually, prepare for each attempt, make it count.
That makes sense. But what if, let's say, first attempt, you totally bomb it, nerves, something crazy happens. Can you just retake it whenever you feel ready?
If you've taken it 2 or more times, it gets a little stricter. Only 1 try per testing window then. And you got to show the ADA you've been applying to dental programs, like actually trying to get in.
So it's not just someone taking it over and over hoping to get lucky.
Right. They want to make sure those retake slots are for people who really need them.
Okay, so you've taken the 8A, you've survived the wait. How do you get those scores, and how do you make sure they get to the right schools?
You don't have to wait too long, usually 3-4 weeks. Scores are online. They go on your DentPin account. That's that ID number you get when you register.
Nice. No more waiting for the mailman. But how do the programs actually get your scores? Do you have to send them?
ADA sends them directly to any programs you put on your application.
Okay, so that's why it's so important to double check those choices,
Right.
right? Once you hit submit, that's it.
Yeah, and this is for every attempt. So if you retake it, all your scores go out.
Full transparency, huh? No hiding those old scores.
Yeah.
All right, let's talk about accommodations. The ADA seems really big on making the AD accessible to everyone.
Yeah, they're awesome about that. Lots of accommodations for folks with disabilities, medical conditions, extra time, quiet rooms, assistive tech. They want everyone to have a fair shot.
That's great. But I imagine there's a process, right? You can't just show up on test day and be like, oh, I need extra time.
Yeah, you got to request accommodations ahead of time, like way ahead. They've got a whole process, and it takes a while to get everything approved.
So don't wait till the last minute. Start early if you need those accommodations.
For sure. And the ADA is really good about helping you through it, honestly. They want everyone to have a good experience,
We've covered a lot here.
All right.
Each section, how to handle those case questions, the whole retesting thing, accommodations.
But there's one more piece of the puzzle, one more thing we got to talk about.
And we're back. All right, so we've hit on a ton of stuff about the ADAT, but there's one more thing, kind of a big theme that the ADA keeps bringing up in their guide.
You're talking about fairness, right?
Yeah.
It's not just like a word they throw around. They really bake it into the whole exam, the design, the scoring, even those retesting rules we talked about.
Exactly. It's easy to just kind of skim over that stuff, but I think it's worth digging in a bit. Like, what does fairness actually mean when it comes to the ADAT?
Well, for one thing, they're constantly checking the exam, updating it, making sure it really measures what it's supposed to. Those unscored questions we mentioned, that's part of it. They use those to make sure the questions are fair, unbiased, and relevant to what dentists actually do nowadays.
So it's not just like a set-in-stone test. It's always changing to keep up with dentistry.
Yep. And that fairness thing, it goes beyond just the exam itself. They're really transparent about scores, too. Remember, every school you apply to, they get all your scores, not just your best one.
No hiding those maybe not so great attempts. So it really makes each time you take it count, right? You
Yep.
got to prepare.
For sure. And it means you got to choose those programs carefully. You're applying to places that'll see your whole ADOT journey, good and bad. Make sure they're a good fit for you, not just your score.
We talked about accommodations earlier, and I think that fits in with fairness too, right? The ADA wants to make sure everyone has a chance, no matter what challenges they might have.
Totally. They've got all sorts of accommodations, extra time, different tech, and they really want people to use them if they need them.
But like we said, start that process early, right? They need time to get it all sorted out.
Absolutely. Don't wait till the last minute. Reach out to the ADA. They're really good about helping you through all that.
Well, there you have it, folks. We went through pretty much everything, yeah, right? All the little things hiding in that guide. Hopefully gave you some good tips along the way.
We hit on ethics, each section of the exam, those case questions everyone worries about, retesting, and of course, how much the ADA cares about fairness, making sure it's accessible.
And remember, the 80, it's not just something you got to get through. It's a chance to show what you know, how you think. It's the start of becoming a dentist.
Keep that in mind as you study, as you prep.
Yeah.
You got this.
That's all for our 80 deep dive. Good luck on your journey to dental school. Thanks for joining us.
And keep learning.